Welcome to the top 5 things to know about preeclampsia, low dose aspirin, and healthy pregnancies, which is part of the March of Dimes. It starts with Mom series. As we talk about what we need to know, what to know every day, this is something the March of Dimes fights for, the health of all moms and babies. I'm honored to be your moderator today. I'm Jummy Olabanji, an anchor with NBC Washington. And it's so wonderful to be joining so many moms today. This is a community that moms need to lean on, people that will listen to them and that will also support them. We know you can't do it alone. Now, It Starts with Mom is an excellent resource for moms and moms to be, as well as for their families to help them, kind of get through pregnancy and beyond. There's so much we feel like you need to know, but it's impossible to know everything, right? But we do know that to have a healthy pregnancy, a healthy baby, healthy families, it starts with community and it really starts with mom. Now, we're going to be talking a lot today, but speaking of what we need to know, we've assembled a great panel for a great conversation with Dr. Diana E. Ramos, Surgeon General of California, Dr. Amanda Williams, Clinical Innovation Advisor, California Maternal Quality Care Collaborative. We also have Demi Schweers, a mom who benefited from low dose aspirin. And we're also joined by Dr. Elizabeth Cherot, President and Chief Executive Officer of the March of Dimes. I'm so excited to see you all and so excited about this conversation. We know that the month of May is Preeclampsia Awareness Month. It's a month-long communication campaign to raise awareness about this life-threatening hypertensive disorder of pregnancy. So, in celebration of that, we're going to go ahead and get started because it starts with mom. So, let's get started. I want to start with you, Dr. Ramos, first. Can you talk about what is preeclampsia? We hear it, but some of our viewers today might not know exactly what it is. So, can you explain it to us?
Sure. Preeclampsia is a serious medical condition that occurs during pregnancy. Can cause high blood pressure from the lower end of the spectrum all the way to seizures and worst case scenario, death. It can also cause complications in the mom with the kidneys, with the liver, and more importantly, it can obviously impact the baby. Having the baby be born early, preterm, and when the baby's preterm, oftentimes low birth weight, they end up in the NICU and can have lifelong complications. So it's a critically important disease, preeclampsia, that we can hopefully prevent and treat so that we can have a healthier mom and a healthier baby.
And Demi, I know folks may follow you on social media, and so they may know, some of your story and your family, your growing family. But can you talk to us about your experience? I know you experienced preeclampsia in your pregnancy, correct?
Yes, absolutely. So last year, around this very time, I was giving birth to my second daughter. She was actually born in a few days, which is crazy. She's almost one. But she was a baby that we conceived via IVF. And also being African American, I also have multiple sclerosis. I checked off a lot of the check marks for precursors to preeclampsia. And with that said, at my first pregnancy, I was not taking any low dose aspirin or anything. We were just keeping an eye on things. And at 37 weeks pregnant, I developed some very intense swelling. My blood pressure spiked up, and I had a very severe headache. And I immediately went to the doctor's office, or the hospital rather. And that very day, I was induced and had my daughter. And fast forward to this year, I am pregnant again with our son. And this whole time during pregnancy, from the minute that I found out that we were pregnant, my doctor recommended me take low dose aspirin. And I'm nearing the end of my third trimester. He's almost here, and everything has been smooth sailing. I've been keeping a very close eye on my blood pressure, taking my aspirin every day. And so far, so good.
I want to just ask a follow-up question, Demi. Oftentimes, women who are having a pregnancy and they might not have had any issues throughout the pregnancy, or maybe they did, but when did you know that I need to call the doctor? What was the sign that really told you, this doesn't seem right?
Yeah, we were actually at a birthday party last year, and while we were there, I just felt myself becoming more and more lightheaded and dizzy, and the swelling in my feet especially really started. ballooning out of control. And I immediately looked at my husband and I said, we have to go. I need to check my blood pressure right away. And we'll call the doctor once we get those results. But I definitely felt that shift and change in my body.
Really good that you were in tune with that. Dr. Williams, if I can bring you in right now, you heard Demi even talk about, especially as an African American woman, maybe some of the things that were pre existing for her. But I wanted to ask you, Dr. Williams, how does someone know if they're at risk for preeclampsia?
Well, thank you for the opportunity to be here and to talk about the work that we're doing in California. Truly, everyone should be screened for low-dose aspirin to prevent preeclampsia, even if they're a low-risk patient. And that's tricky because it's a high-risk condition, yet it can happen in low-risk people. So that's why we need the universality of the screening, and then we can get people the follow-up that's needed. What we also want to try to do is put it in the hands of the patients. I mean, there's so many good doctors and midwives out there, but people are busy. They might overlook it. We want patients to be empowered with this knowledge so that they can then bring it to their doctor or midwife and say, should I be on low-dose aspirin? So who should be on low-dose aspirin and when should this happen? So ideally, we want people to start around 12 weeks of pregnancy. And the people who are at the very highest risk are ones with some medical conditions that are more serious. So if you have chronic hypertension or high blood pressure before pregnancy, if you have kidney issues, if you have diabetes, if you have an autoimmune disease like lupus, if you had a prior pregnancy with preeclampsia, or if you have twins, triplets, those are the people who are at the very highest risk and absolutely need to be on low-dose aspirin. There are also some demographic risk factors. So these are things that, because of the way that our community works, because of toxic stressors, we have to think about other folks being at risk for preeclampsia, not because they're sick, not because of something they did wrong, but just that statistically, that's where we see the condition. And those are things like, are you obese? Are you from a group that has been historically subject to systemic racism, such as Black or African American patients? Are you over 35? Did you conceive by IVF? Are you experiencing financial hardship? Is it your first baby? So these aren't medical conditions, but these are demographic risk factors. And if you have two of those demographic risk factors, and in some cases, even one, you should be having that conversation with your doctor about low-dose aspirin. So truly, we want this to be in the hands of patients so that they can lead up to their healthcare provider and get them engaged in really that partnership that's required to keep people safe and healthy during pregnancy.
Thank you so much, Dr. Williams. Dr. Cherot, I want to bring you in now. Obviously, your work as a doctor, but also with the March of Dimes, you all are really passionate about healthy babies and healthy mothers. How common is preeclampsia, and how much are you seeing it in your work?
Sure. No, great question. Actually, 1 in 25 pregnancies in the United States has preeclampsia, and that is quite significant if you think about it. Actually, 1 in 7 to 1 in 8, depending on the data that you read, hospital admissions is affected by some kind of hypertension in pregnancy, whether that's during labor, that's pre-pregnancy, or after. It's kind of amazing. It's high numbers. And just like Amanda mentioned, low-dose aspirin can have a profound effect on preeclampsia. We think it reduces preterm birth as well as a consequence of that. So really excited to launch this campaign and really get the word out for patients to bring up, should I be screened, or everyone should be screened, but should I be on it? And we also really are hoping to get to providers to also bring it up to make sure that they're doing that on a regular basis. I think we all know providers can be very busy, whether midwife, right, whether it's a doc. We're all very busy in the office, but want to make sure the patients are really informed and screened appropriately. we're really excited. It's called Low Dose, Big Benefits. It's a multi-pronged approach that we're starting this campaign. We're launching it this month. We're excited to do it here with It Starts With Mom. And if you've seen Allison Felix, right, or and our big promotion, you can see over my shoulder, I'm all excited with the logo. Yeah, it's really exciting that we're launching. And Allison, 11-time Olympic medalist, right, incredible. And she is really helping us promote this. She just had her second child, and she too, with the first pregnancy affected by preeclampsia, just delivered full term with her, with her low dose aspirin during that pregnancy. I'm happy to introduce Allison Felix and for her to share her story.
We knew that we wanted another child. We knew that we wanted Cameron to have a sibling. We knew the risks. We knew that I had preeclampsia before. I could very likely have it again. And I think we understood more of what that meant. And it's scary. Like, I want to be here to raise my children. I want to see my family grow. This time around, since I've had preeclampsia before, I was educated about low-dose aspirin and how that can reduce the chances of having preeclampsia again. Not only was I not aware from my doctor telling me, but in the conversations that I was having with my friends, with my family, preeclampsia didn't come up once. And if something like taking a low-dose aspirin every day can be preventative, then we need to be shouting that from the rooftops. And so that's why I want to be involved. That's why I want to raise awareness, because I think ultimately this can save lives and save families.
So, Demi, I'm going to bring you back in now to the conversation. You mentioned earlier that you took low dose aspirin. Just talk to us about that experience. Did you take it every day? How did it make you feel? What that was like?
Absolutely. Unfortunately, with my first pregnancy, I was not taking it. And, that is what inevitably had preeclampsia sneak up on me. However, this time around, as I said, I've been taking it pretty much since the beginning. And it's just part of my routine. You take your prenatals every day, and right in my little pill box is my low dose aspirin. I'm taking it every day. I don't feel any different or any side effects from it. It's been honestly probably one of the biggest blessings throughout this pregnancy. It's one thing that, yes, I'm of course keeping a pulse on because it can turn and become so serious so quickly, but it's enabled me to feel ownership and some control over this pregnancy, and to make sure that I'm doing all the best things that I possibly can to ensure that this is a healthy pregnancy and baby boy arrives full term.
And how to compare to your first pregnancy, just how does it make you feel that essentially just a simple pill, as you're saying, it's in your pill box, you're taking every day, has changed the course and how you've been able to feel with this second pregnancy?
I honestly feel so grateful. I wish in hindsight I had known and been informed about all of the risk factors. I had more than probably 3 checked off of that list that Dr. Amanda Williams was saying. And I wish I had known about that sooner, to be completely honest. But I'm so grateful that I have the information now. I have those resources, and I talk about it quite candidly with our community just to raise awareness on that. And, I just feel so blessed to be able to be doing it this time around and incorporating it into the routines, especially knowing how scary it was at the end with my daughter once it was time for delivery, and worrying about both not only my health, but her health as well. So definitely a blessing.
Yeah, and it is a blessing to be able to share that with your community, because that's so important, having those conversations. And we know research is important as well. So, Dr. Williams, Dr. Ramos, either of you start first. Can you talk about some of the research being done on low dose aspirin that's been piloted in California, and also the work being done in California, what that means for moms, not only in that state, but really across the world?
Right. Yeah. So as California Surgeon General and an OBGYN, maternal health is of utmost importance here in California. And we have been partnering with the March of Dimes since 2011 and before. I personally have been working with the March of Dimes on maternal health issues. But in 2011, the March of Dimes launched the Stanford Prematurity Research Center. And that was the nation's first research center dedicated to identifying the causes of preterm birth. So along the lines from that work, the realization over time has come to the fact that when we address the health of the baby, you're really addressing the health of the mom, the health of the family. So subsequently in 2015, from the initial 2011 to then the 2015, the March of Dimes created the prematurity campaign roadmap. And the roadmap highlighted 8 areas that could reduce preterm birth. And one of those was low dose aspirin. So it wasn't until 2021, so 10 years later from the initial investment, that faculty and staff from the California Maternal Care Quality Collaborative, the March of Dimes, and the Stanford Prematurity Research Center started the implementation plan for the low dose aspirin campaign. So it really has been a journey, a partnership, and a cross collaborative that is so critically important when we're trying to impact the health of a whole community, a whole state. And the other thing to really keep in mind that yes, oftentimes prematurity is associated, unfortunately, with maternal morbidity, mortality. We need to realize that 80% of all maternal deaths can be preventable. So if we can prevent, I mentioned in the beginning that preeclampsia, the worst case scenario is maternal death. We can actually improve and prevent maternal deaths and improve the outcomes for babies. And I know Dr. Williams has been working extensively with Stanford and the California Maternal Quality Care Collaborative.
I mean, it really is fantastic because we take what we call bench research, sort of the test tube lab sort of research, and then we figure out what kind of interventions are possible. So we then understand that something as simple as a low dose aspirin, 81 milligrams that you can get at your local drugstore, can actually prevent something that is one of the leading causes of maternal death. How incredible is that? That is possible. But why isn't it being done? Why isn't everyone who is eligible for this taking it? And there are myriad reasons. So then I get to partner with my decision analysis colleagues who run Monte Carlo simulations to figure out how people get influenced, because there's social media, there's print media, there's your family, your granny telling you. They didn't have this. When I was pregnant with my son 20 years ago, this didn't exist. And I had preeclampsia. So it is very, very near and dear to my heart to figure out, how do we get the word out in a way that people can hear? We also have to acknowledge that there's some very well-earned distrust in the medical community, especially for people of color. So we've got to take this head on. And when we're having hard conversations, so we need our patients to feel our compassion. We don't want them to just feel, oh, she thinks I'm fat and black and now I've got to be on something every day. No, it's that we live in a society where there is toxic stress and we have the ability to intervene to keep you and your baby safe with something simple and prevent a life-threatening condition. We've got to be able to frame this in a way that our patients can hear. And by working through the Stanford Prematurity Research Center and the California Maternal Quality Care Collaborative, we can really analyze how this is being done and bring in patient voice. So we have a community advisory board that looks at every single thing we develop. And if they tell us, we don't just get their opinion, they have decision-making power. So if they tell us, sorry, Dr. Williams, no one's going to read this, or like, those graphics are terrible, like, we got to throw it out. Because you've got to listen to patients, because they're the ones who are, if they're not going to really hear the information, if it's not going to be integrated, then we might as well not have it. So it is such a privilege to work along this sort of from the very beginnings of research to decision-making analysis, to community engagement, to really health promotion. In an area that disproportionately impacts women of color. It is just absolutely a phenomenal opportunity. And it's so exciting to be partnering with March of Dimes and with the Surgeon General's office to be able to bring this work forward.
I just love your enthusiasm, Dr. Williams. It's just great, right? It's so neat to see us go to test tube to really something that was incubated in California. I got to give a big shout out. It's not just the PRC, but Dr. Ramos, it's really been amplified. You guys have really done the implementation science behind this for us to be able to really launch more broadly. And the impact, just think about it, can be incredibly profound. We know that not everybody should be taking aspirin, by the way, so we want everybody to ask their provider. But I love your enthusiasm is just like, I'm just sitting here going like, yes, our biggest champion. And really loving that this is something that, you know, we are launching now that we know is going to be multi-year, that's going to take a while to really get out the word, but all of your early work is so influential here and so exciting to see take off. So I just had to get a shout out to California, Dr. Ramos, Dr. Williams. It's because of you. It's one of those early things that, you know, we at the March of Dimes listened to on what you were doing and how successful you had been and your barriers and the struggles you've had. I'm hoping we do you justice by launching this, and really excited to see you along with our campaign. Really excited about it.
And I do want to piggyback on Dr. Williams' highlight of, you know, the diversity of California, and really critically important to realize that so goes California, so goes the rest of the country. And in California, we really take into consideration equity, access, culture, and yes, are very responsive to the Black community that have a disproportionately higher number of maternal deaths, maternal morbidity, higher risk for preeclampsia, but also delivering the information in a culturally sensitive manner for the Black community, for the Latino community, for the Asian community, really bringing in their voices, as Dr. Williams had said, to make sure that the messages resonate and the education and then the decision making is available for all patients and families.
I also just wanted to add into, from not the medical side, but just as a patient and as a mother who's experienced it, that it also feels so empowering hearing how enthusiastic all of you are about this and getting the message out. Because one thing that I've said throughout my whole health journey is you have to be your own best advocate. And it's so wonderful to hear that enthusiasm from all of you, because I advocate for myself all the time. And it's so reassuring and so empowering to know that just having this slight conversation of, hey, you know what, I did IVF, you know, does that put me at a higher risk for any other health conditions? And I am someone who's mixed. And when I go to the hospital or in the doctor's office and they want me to check off my ethnicity, sometimes I just press other, and they're not sure what that other encompasses. It doesn't usually give us that option. So it's really nice to know, you know, being a person of color and being within the Black community and being someone who went through IVF and who also has an autoimmune disease. It's so empowering to know that, hey, these are the things that I'm dealing with. And I know, and I can trust that I can go to my doctor and have these open conversations and get the help and the preventatives I need to take ownership of my health. Because as, you know, researched and informed as you all are, I feel as if as moms, we know when something's just not right in our body and when to seek help, and to know that we can do that in a safe space is just so empowering.
This has just been an excellent conversation. And, you know, just in case if someone is watching this, maybe they're just passing by it right now and joining in. So, Dr. Ramos, just once again, can you talk about the safety of taking aspirin during pregnancy, and how does someone know if low-dose aspirin is right for them?
Right. So in general, low dose aspirin, baby aspirin, is safe for most people. I say most. It's critically important that you talk to your healthcare provider, because you may have some medical conditions that may preclude you, that may not make it able for you to take it. You may be on other medications that don't combine well with aspirin. So talk to your doctor. Something simple as starting that baby aspirin after 12 weeks of pregnancy all the way to delivery, as we have heard, can help prevent preeclampsia. And the bad things about preeclampsia is that you can have a preterm baby. And unfortunately, it really strikes you when you see the baby in the NICU, in the neonatal intensive care unit, that you can't take that baby home with you because they've been born too early. But please know that the support is there. The support is there for you to try and, one, provide you the information, provide the education so that you can make that decision in combination with a conversation with your provider. And you can decide if that low dose aspirin is right for you. And as Dr. Williams had cited, there's a lot of risk factors that put you at higher risk for being Black, having experienced stress as well, racism, as well as having had preeclampsia in the past, having had a relative, a sister that had preeclampsia, diabetes, a whole list of risk factors that are there. But I would encourage folks to go to marchofdimes.org, marchofdimes.org/low dose big benefits, marchofdimes.org/low dose big benefits, and find out a lot of more information as to the risk factors, as to questions you should be asking your provider when you go and ask more about, is the baby aspirin the right thing for me? And if you've had preeclampsia, what else should I be doing?
And Dr. Williams, I just want to ask, just to be clear, I mean, oftentimes with women, we worry about our family's finances and we go to the store and we see the different brands and things, but this is just drugstore brand low dose, right? You're not having to look for something fancy with the label from the internet or anything like that, that seems, but right?
Nope, this is just plain Jane, any pharmacy, low dose aspirin. And at some time before I retire, I want to see the low dose aspirin and the prenatals together in the grocery stores, in the drug stores, because truly it's more likely that someone needs to be on it than they don't need to be on it. We want patients to start early in pregnancy, usually around 12 weeks, but our research has shown us that there is benefit even if you start it a little bit later, all the way up into the beginning of that third trimester. So it's not too late. You can start it, and then you do continue taking it every day until delivery. Now, that's a big deal because a lot of pregnant patients don't want to take medications during pregnancy. They want to have as holistic an experience as possible. And it's important to remember that this is armor you are putting around your baby. We cannot guarantee that you won't get preeclampsia, but if you get it, you might get it later. And your baby might not have to be in the neonatal intensive care unit, or you might not get it at all. So it's giving your baby and you a chance to have the healthiest pregnancy possible. We have data now that shows us how much of uptake has there been. And when we look nationwide, for patients who are at the highest risk for preeclampsia, so those are people who've had preeclampsia in a prior pregnancy or who had high blood pressure prior to pregnancy, only 50% of them are taking it. Then when you look at patients who are African American or Black, only 10% are taking it. So it speaks volumes about so many things: lack of trust, not getting education to people, not having the right community information available. So we've got to do better, which is why I need to take my position of privilege of being a Black woman and a physician with this expertise and a woman with lived experience with preeclampsia, and use my position to try to promote, not just with patients, but to teach my colleagues how to talk to people. Because if people don't feel like they're being talked to in a respectful, trust-building manner, they're not going to do it. And it is hard to convince a patient to do something when their auntie tells them, no, you don't need that. Don't take that. I had 6 babies and I didn't need to take that. Like, we need to figure out how to change the messaging and give it in a way that people can understand and people can really hear the love and trust that's behind it.
And Demi, I just to bring you in now, these days a lot of folks, they trust women in your position, women who are active on social media and have a great personality and a following. And so, what is your message to women who it might be hard for them to hear information from a physician, but they'll take it from you? So, what is your message for them today?
I think, as I said earlier, be your own best advocate. Nobody knows your body better than you do. I think one of the best things that I've done since my last pregnancy and this pregnancy is getting a baseline of what my blood pressure typically looks like. I personally know that my mother and my grandmother both have lower blood pressure. So when mine is creeping up, although it is still within normal range, it is high for me. And I wouldn't know that if it wasn't something that I was taking the steps to know and educate myself on. So I think being your own best advocate is truly one of the most empowering things. And having those open conversations with your doctor and with your medical team, whoever that may be, to know what those precursors are, what preventatives can you do, and just to know your general baseline. And with that, I actually organically shared, I think it was last week, um, that my blood pressure was a little bit higher than normal. And a lot of people were like, oh, no, that's fine. That's normal blood pressure. And I said, no, hold on a second. This is high for me. I know my baseline. I know my precursors. I know that I am more susceptible to developing it again. So even though it is within normal range, I'm going to take the next steps. I booked an appointment the next day and went down to get some blood work done and just some labs tested just to make sure that things were still in a good standing. And it was really encouraging for a lot of people. And I got so many messages saying, their personal stories with preeclampsia or their loved ones' experiences with it. And, the range of those outcomes was pretty vast. And I think it's just so important to get those messages out. And I know that I'll do my due diligence and continue to do my due diligence moving forward to talk about the experiences that I go through.
Well, sharing your story is so important. Thank you so much. And Dr. Cherot, can you talk about, I know Dr. Ramos brought it up a little earlier, but that website, marchofdimes.org
Yeah.
slash low dose big benefits, just talk about what's there when
Oh,
folks head to that link and why it's so important.
Yeah, it gets into a whole bunch of information on our campaign. It really gets into signs and symptoms as well, both for patients but providers to really look at. And also it really gets into the campaign. We're doing a whole work on QI project a quality improvement project that we're getting excited to launch too. So the website gets into the details of how we are launching our low dose aspirin campaign. And gets into a lot of details that people can be partners with this as well if they want to continue to amplify, just as we're doing here today. But all of that information is on that website, and would love people to go to the marchofdimes.org or I think it's / low dose big benefits, and really excited to have people see some of the videos that we've created, some educational material, and then if people want to get involved.
Wonderful. Thank you so much. This has been an excellent conversation. I thank you all for being with us today. Once again, Dr. Diana Ramos, Dr. Amanda Williams, Demi Schweers, and Dr. Elizabeth Cherot. Thank you once again for this just really impactful, important conversation. I got a lot out of it. I hope those watching did as well. We know moms are the heart and soul of our world, and every mom and mom to be deserves the best, especially when it comes to their health and well-being. March of Dimes and It Starts with Mom Outreach is here to help you, educate you with reliable, up-to-date information for you to take charge of your pregnancy journey. We know pregnancy can be a wild ride sometimes, but know that you are not alone. You can be part of a powerhouse community that understands and also uplifts each other. It Starts with Mom is always available as an on-the-go resource packed with information you need from planning to pregnancy to postpartum. To learn more about future events, the It Starts with Mom platforms, the Low Dose Big Benefits campaign, and also access to education resources, you can visit itstartswithmom.org. The organization is also inviting Americans to text low dose to 40789, and that'll give a gift that supports the March of Dimes efforts to help ensure moms to be have access to information and the resources they need. Once again, we want to thank our partners, HCA Healthcare, Clear Blue, Goldbug, The Honest Company, Philips Avent, and Sanofi for supporting March of Dimes and making all of this happen. Again, for all the information you need, go to itstartswithmom.org. I'm Jummy Olabanji. I'm so glad to be with you today, and thank you for joining us.